Hi guys, so Jake and I were assigned the position statement of sudden death in sports. Unfortunately, we cannot go through every single cause of sudden death in sports, so the position statement pretty much covered the top 10 conditions for sudden death, including asthma, catastrophic brain injuries, cervical spine injuries, diabetes, exertional heat stroke, exertional hyponatremia, exertional sickling, head down contact in football, lightning, and sudden cardiac death. So instead of going through every single cause of death, which would have taken forever, we chose the most common one, which is sudden cardiac arrest. And so we will show you the recommendations from this position statement on how to recognize it, prevent it, and treat it. Sudden cardiac arrest is the leading cause of death in exercising young athletes. The underlying cause is usually a structural cardiac abnormality. Hypertrophic cardiomyopathy and coronary artery anomalies are responsible for approximately 25% and 14% of sudden cardiac death in the U.S. Commotio cordis accounts for approximately 20% of sudden cardiac death in young athletes caused by a blunt, non-penetrating blow to the chest. It induces ventricular arrhythmia in otherwise normal heart. Other structural anomalies that can cause sudden cardiac arrest include myocarditis, arrhythmogenic right ventricular dysplasia, Marfan syndrome, among others. Okay, you can stop. How do you prevent sudden cardiac arrest? First, you have to perform a PPE before the season starts in order to catch any pre-existing conditions in the athlete. Make sure that you have prepared for any emergencies, such as establishing an EAD, also quick access to an AED, and have all necessary equipment highly visible and accessible. Again, prevention of sudden cardiac arrest include access to early defibrillation. A goal is less than 35 minutes from time of collapse to delivery of the first shock is strongly recommended to save for the best way to save the athlete's life. The pre-participation physical exam should include the completion of a standardized history form and attention to episodes of exertional syncope or pre-syncope, chest pain, a personal or family history of sudden cardiac arrest, or a family history of sudden death and exercise intolerance. Recognize sudden cardiac arrest. Sudden cardiac arrest should be suspected of any athlete who has collapsed and is unresponsive. A patient's airway, breathing, circulation, and heart rhythm using the AED should be assessed. An AED should be applied as soon as possible for a rhythm analysis. Any jerking or seizure-like activity is often present after the collapse from sudden cardiac arrest and should not be mistaken for a seizure. Occasional or agonal gasping should not be mistaken for normal breathing. Once your athlete has gone down, how do you manage the situation? First, CPR should be provided while waiting for the AED, and the AED needs to be applied ASAP. Also, have someone call EMS while conducting CPR. Minimize interruptions in chest compressions by only stopping for rhythm analysis and defibrillation. Follow American Heart Association guidelines. Chest compressions, airway, and breathing. Points in the treatment of an athlete that goes down from sudden cardiac arrest is if any athlete who collapses should be suspected of sudden cardiac arrest. If normal breathing, a pulse absent, start CPR ASAP, activate EMS. Continue until EMS arrives. Early defibrillation, prompt CPR, rapid activation of EMS, and early detection are vital for survival. Move the patients lying on water if it is raining, and if there is lightning, move the patient indoors. We're going to show you an athlete going into sudden cardiac arrest, and we'll show you the steps on how to treat the athlete. So since the athlete collapsed, we're going to assume that he went into a sudden cardiac arrest. We saw that he did have a little bit of seizure activity, and we're going to take that as another sign of sudden cardiac arrest. So the first thing you do when you get to the scene is check to see if the athlete is responsive. So Charlie, are you okay? Charlie. So he's not responsive, so next you want to check for breathing and to see if his chest is rising. And check for a pulse. So he is breathing, but he does not have a pulse, so what you want to do is send someone to get the AED and send someone to call EMS. And then you want to start CPR as soon as possible until the AED arrives. So we're going to do 30 straight compressions. Once you do the 30 compressions, you check for breathing, or you check the pulse again, and also check for breathing to make sure he's still breathing. If there's still no pulse, continue with the compressions until the AED arrives. Again, it's 30 compressions. Once the AED arrives, you want to place the AED on him and just follow the directions. So we're going to say that we placed it on him, and it's going to advise to shock. 1, 2, 3, shock. So you want to just follow the AED's directions. If it says continue compressions, and continue compressions, and continue that cycle until EMS arrives. Just some key point of this whole process is to make sure that you have the AED easily accessible. The sooner you place, the sooner the defibrillation, the best chance of survival the athlete will have. Okay. Yeah.
Thanks for saving my life. Athletic trainers rule. Go Lopes! There go!
So like mentioned in the beginning, there are a lot of other causes of sudden death in sports, just like the ones that I listed at the very beginning of this video. So we just wanted to cover the most common one, which is sudden cardiac arrest. I hope that you learned something new from this video. So just again, the most important thing is prevention with the pre-participation exam. And then and in case all things can't be prevented, of course, so then just be prepared for any emergencies, have an emergency action plan, and then also make sure that you have the AED easily accessible at all times. So hopefully this video isn't too boring.